Welcome to Constant TV, where legitimacy and consistency rule. Today, we are going to bring to you the importance of understanding illness behavior and exploring the main behavioral characteristics. If this is your first time, please endeavor to subscribe, like, comment and share our channel. Thank you. Let's dive in. Introduction. Illness is a complex and multifaceted experience that affects millions of people worldwide. It can manifest physically, mentally, or emotionally, and its impact can be significant, affecting not only the individual but also their loved ones and community. While illness is often viewed as a solely medical phenomenon, it also has behavioral aspects that play a crucial role in its development, progression, and management. It's also defined as the expression of the adaptive reorganization of the priorities of the host during an infectious period. The major feature of sickness behavior is a general decrease in activity, immobility, sleepiness, reduced food and water intake. Health and illness behaviors are associated with level of disability, quality of life, patterns of illness, and risk of death. It is tempting to view such health-related outcomes solely through the lenses provided by the biomedical sciences. However, the behaviors that importantly shape individuals' experiences of sickness or wellness, and life or death, are more completely understood from a sociological perspective. The confluence of individuals' life histories, their personality characteristics and social experiences, and their social positions influences health and illness behaviors and tells us much about how to enhance health and well-being and mitigate disability and sickness. An examination of health and illness behaviors, therefore, has important public health implications. The study of illness behavior is concerned with the way people monitor their bodies, define and interpret bodily indications, make decisions about needed treatment, and use informal and formal sources of care. Like other behavior, illness behavior is learned through socialization in families and peer groups and through exposure to the mass media and education. There is great diversity of attitudes, beliefs, knowledge, and behavior, all of which affect the definitions of problematic symptoms, the meanings and causal attributions that explain them, socially anticipated responses, and the definition of appropriate remedies and sources of care. Motivation and learning affect the initial recognition of symptoms, reactions to pain, the extent of stoicism and hypochondriasis, and the readiness to seek release from work, school, and other obligations and to seek help. In short, illness appraisal is a two-step process. In the initial step, persons monitor their bodies to assess the location, duration, intensity, and persistence of discomfort. In the second stage, which may occur almost concurrently, they seek explanations for perceived changes. If an obvious explanation is not available, or is disconfirmed by further checking, individuals look to their environment for new cues and explanations. These interpretations, in light of knowledge and other beliefs, may then play a role in the formal initiation of care. In this video, we will delve into the main behavioral characteristics of illness, examining the key traits and habits that define this experience. 1. Avoidance behaviors. Individuals experiencing illness often exhibit avoidance behaviors, such as dodging medical appointments, ignoring symptoms, or refusing treatment. This avoidance can stem from fear, anxiety, or denial, and can worsen the illness if left unchecked. 1. Help-seeking behaviors. On the other hand, some individuals may exhibit help-seeking behaviors, such as consulting multiple doctors, trying alternative therapies, or seeking support groups. This proactive approach can lead to better management and outcomes. 2. Coping mechanisms. People dealing with illness often develop coping mechanisms, such as substance abuse, escapism, or social withdrawal. While these mechanisms may provide temporary relief, they can also exacerbate the illness and hinder recovery. 3. Non-adherence behaviors. Non-adherence to treatment plans is a common behavioral characteristic of illness. This can include neglecting medication, skipping appointments, or disregarding lifestyle changes. 4. Mental health behaviors. Illness can significantly impact mental health, leading to behaviors such as depression, anxiety, or suicidal ideation. It is essential to address these behaviors promptly to prevent further deterioration. 5. Social withdrawal behaviors. Illness can cause individuals to withdraw from social interactions, leading to isolation and loneliness. This can further exacerbate the illness and hinder recovery. 6. Self-care behaviors. Some individuals may prioritize self-care behaviors, such as exercise, meditation, or healthy eating, to manage their illness. These behaviors can improve overall well-being and enhance recovery. 7. Support-seeking behaviors. Seeking support from loved ones, support groups, or mental health professionals is a crucial behavioral characteristic of illness. This support can provide emotional comfort, practical assistance, and valuable guidance. 8. Advocacy behaviors. Some individuals may exhibit advocacy behaviors, such as seeking second opinions, questioning medical professionals, or advocating for their rights. This proactive approach can lead to better care and outcomes. 9. Resilience behaviors. Finally, many individuals facing illness exhibit resilience behaviors, such as positivity, adaptability, and determination. These traits can help them navigate the challenges of illness and emerge stronger on the other side. Conclusion. By examining various psychological, familial, social, and cultural influences on illness behavior, we have tried to illustrate the many sources of variation observed in chronic pain patients. Responses to alterations in bodily functions are consciously and unconsciously determined by a complex web of interacting influences. No one variable will ever fully account for the patient's experience with pain and illness. There also is no one-to-one correlation between pain behavior and disease, and no single psychological profile of chronic pain patients. Social factors may strongly influence pain behavior, but they are not fully determinative. Culture and ethnicity may determine certain components of the pain experience, but cultural characteristics must be understood as general patterns that may or may not be relevant in the case of any particular individual. Not everyone responds in culturally predictable ways, neither can it be assumed that each social or cultural group is unique. There can be no clear-cut manual of responses to pain patients of particular socio-demographic, occupational, or cultural groups for use by healthcare providers or disability evaluators. Understanding that these and other characteristics can influence the perception of symptoms, the meaning attributed to them, and how they are expressed and coped with sensitizes healthcare professionals and disability examiners to potential sources of variation. It can lead to better history-taking and communication about illness and treatment, but it does not provide a formula for how to interpret and treat patients' complaints or illness behaviors. Illness behavior is useful for understanding observed differences. The fact that individuals perceive, interpret, express, and cope with their pain in different ways does not in itself address the question of who should receive disability benefits. Simply knowing a person's diagnosis is unlikely to be a good proxy for presuming a particular level of impairment. The meaning of the illness and the experience of the individual are crucial to assessing functional capacities and limitations. In conclusion, illness is a complex experience that encompasses a wide range of behavioral characteristics. By understanding these traits and habits, we can better support individuals facing illness, improve health outcomes, and foster a more compassionate and comprehensive approach to healthcare. Thanks for watching.